failure to address the rise in mental health issues in almost every country around the world. That is, of course, according to a report published in the Lancet Medical Journal. Today, as Peter said, that it is World Mental Health Awareness Day, and the report continues to suggest that more than 1 billion people are affected by mental health disorders worldwide. The warning really that there's a warning that in many countries people routinely face abuse or detention for mental health issues, and only a few of them get full support that they need. Let us now take this discussion further with the Chairperson of the Psychiatry Management Group, Dr. Sebolelo Seape. Dr. Seape, good afternoon to you. Thank you so much for coming through.
Good afternoon, Palisa. Thanks for having me.
Thank you so much indeed. This is a very important subject that we're discussing this afternoon, and looking at this year's theme on its own, youth and mental health, one cannot help but notice that this problem does not just affect the young people in South Africa, but as I said on my introduction, that it is a worldwide problem.
No, mental health is a worldwide problem. It's everybody's problem. And as you've said, a large number of people are affected by mental health issues. In South Africa, in one study that was done, I think it worked out that about 16.5% of people have mental health issues at any one time. And the prevalence of anybody to have a mental health issue over the year or their lifetime is 30%, which makes it almost a third of the population will have a mental health issue sooner or later.
Yeah,
which is a large number of people.
And then amongst the youth, how prevalent is it, especially here in South Africa?
Well, the one study that was done under the supervision of SADC said that up to 20% of high school students had mental health issues, which is a large number. And we also know that 10% of suicide is the second highest killer of teens.
Yeah.
You know, well, it's about 1 in 10, which is a very high number. So it's very, very prevalent.
It is.
And you'll find that girls try to commit suicide more regularly, boys succeed more regularly. Mm-hmm. And I think a loss of 10% of the youth is a large number, especially when we know that a large population, especially on the African continent, is young people. And if we're losing 10%, it's a disaster.
Mm. And I'm also looking at a report compiled by SADC here. It says 1 in 4 university students had been diagnosed with depression. So we've seen a number of suicides at high institutions of learning recently. So this talks to that particular point. But let us just look at the contributing factors. Why would young people be so depressed and have anxiety?
Okay, there's a multitude of reasons why young people get depressed. I think starting with the teens specifically, you know, teenage life or time is very, very stressful. Yes, it's very exciting for many, but it can be very stressful because there are so many changes, from just changing in your body to changing schools or maybe preparing for exams, you know, which are now serious, which in primary school it was never so serious. And you now have to look after yourself. Lots of people at that time are leaving home or going to varsity. They start now thinking and understanding that it is important to succeed.
Pressure from parents as well?
Sometimes parents are so pressurizing because they are living or wanting their wishes to be expressed by their children.
That's true.
And there's also family strife usually that is happening, and it's very, very destructive, whether it is family, even simple things like family moving house or family fights, divorces or other losses in the family. Of course, there is a lot of peer pressure. And in the teenage years, again, is a time when people get exposed to substance abuse. They start understanding things differently, and they think and understand things differently. You know, simple things like when you were younger, you went to church with your parents or whatever your religion is. And when you're a teenager, you start to think about it, that do I really want to do this? Is this about me? And, you know, those type of things. You start having your own political ideas, which might be in conflict with your parents, with your peers, with your friends. You know, there are so many.
So there are a number of things and factors.
Including normal things that are affecting many, many people at the same time. Poverty, strife, war, illness. There's a lot of pressures on the young person. But what are
the signs? Let's just focus on the signs maybe. As parents, what should they be on the lookout for?
As parents, we must be on the lookout for little changes. You know, sometimes people become more quiet, they become more isolated, they are withdrawn, they're sitting in their bedrooms alone, they become irritable, they become a bit nasty, their sleeping patterns may change, their eating patterns may change, their school performance may change. And when they really are becoming suicidal, maybe sometimes They will give away things that you didn't expect them to give away because you thought they loved them that much. And very frequently, young people, when they are going to commit suicide, in fact, not young people only, many people, they do give some verbal hints. But unfortunately, what happens is that the person they're talking to usually is unaware and is not hearing them the way they should be hearing.
Until it happens.
Until it happens,
yeah.
you know.
And the stigma as well around mental health illness, I believe it's one huge problem that should be addressed.
It is a big, big problem, that, you know, that there is so much stigma around mental health. A lot of it, because people are unaware, people don't know. It's a lack of knowledge. It's a lack of understanding. And things like the media, much as it's very, very useful, I'm talking about movies and things like that, they usually portray mental health in the most unsavory way, which then builds on the stigma and the lack of understanding. Whereas actually maybe we should think more decidedly that we should use the media more to our advantage, to inform people, to make people aware, to give people information about what's available and what they can do.
All right, there's so much to get to, but time constraints. Dr. Seape, we'll leave it at that for now. Thank you so much for coming through.
It's a pleasure.
All right, well, there you have it. Dr. Sebolelo Seape is the chairperson of the Psychiatry Management Group, of course, talking to us about this important topic of mental health issues, of course, and the stigma around this particular topic. So do remember that earlier we asked you for your thoughts on World Mental Health Day, and our Twitter handle is @SA Today. Let us take a look at some of your